Welcome back to Made to Be Whole. This week, we are going to give you a case study on the successful treatment of Bartonella and PANS. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Welcome back to the show. Per your request, we have a case study of a patient who was quite sick and is doing quite well. This is shared with permission. This is actually a 15-year-old, and I was able to get permission from both her and her parents. Obviously, that was important, and interviewed them for this podcast so they know what we're talking about and have given their blessing for all of this. And I would like to thank them for their willingness and courage. I offered to change the name of the patient, but Emma wanted me to use her real name. And Emma is a fantastic success story. I'm so proud of her. I'm proud of her family. I'm just thrilled with the way her life has turned around. And I wanted to share this because I think it gives a great illustration of how infection can impact mental health, but also the path to recovery, which was a little jagged, but so that you can see the things that helped them be successful and learn from that, and to also have hope, because Emma's symptoms were very, very severe, and she's doing fantastic. So where this all started, the family lived in Pennsylvania in 2019, and Mom does say that there were several ticks that they pulled off Emma during that time. And they also have an outdoor cat and an indoor-outdoor dog. So we've talked about how cats particularly can be a vector for Bartonella because of flea infestations, especially outdoor cats or indoor-outdoor cats. But Emma was high-functioning, happy, going to school, doing well. And then in the summer of 2021, it was in July, she completely changed. It was over a 2 to 5 year period. There was a sudden onset of age regression, more childlike symptoms, OCD, anxiety, near psychosis. Mom said, and I'm quoting, it was like overnight she became OCD. She was only able to watch one show. She thought if she watched something else, something bad would happen. She didn't feel safe. So this took on a really interesting presentation that you can see how someone could really misinterpret it and treat it very differently. It could have been misinterpreted as like a psychotic break. But because Mom was really attuned to this, she was able to figure out what was going on. So Emma became suddenly very obsessed with anime, especially a very specific show, and she would only watch that. She would not watch anything else, and she didn't like anything else to be on in the house. So if Dad was watching a football game, she would walk backwards through the room with her eyes closed and her ears covered so she didn't hear. She was afraid that if she saw other things, that bad things would happen to her. She would only wear anime clothing. She would only read manga. She would only drink from like a cup that had her favorite anime on it. She told her mom, I'm drinking from this cup because it's anime and I'll be safe. When they first came to me at the end of 2023, her parents reported that she hadn't voluntarily left the house in 3 years, that she'd screamed all the way to the appointment. She didn't even call her parents Mom and Dad at that point. She called them Mom Shorty and Dad Dogface because Emma has a sense of humor, but she felt safer that way. Her self-care declined. It was really difficult even to want to shower because she was in a different world. She had to step outside of that anime manga world. So her mom and dad would have to play anime music to get her into the shower. Most of the time she was spending in the basement at that point and didn't again, want to be around other things other than anime or manga. So in March of 2023, she was seeing someone else and they made a clinical diagnosis of PANS, that pediatric acute onset neuropsychiatric syndrome that we've discussed in other episodes. So that provider started treating her with antibiotics. They weren't sure the cause at that point, and there wasn't a lot of change or improvement. She later that year, she got COVID and the Bartonella lines appeared on her. So we've talked a little bit before with Bartonella, there can be some really interesting and unique dermatological manifestations, meaning the skin. So there can be Bartonella striae. Striae are stretch marks, but these are typically unusual because they will, first of all, frequently be discolored. They'll be more a red or a purplish hue, and they will be against like the plane of the skin. So instead of going the direction your stretch marks go if you've gained weight or if you've had a baby, they'll go in a different direction. I frequently see them with my patients who have Bartonella. I'll see horizontal stretch marks in the middle of the back or on the lower back. Sometimes they'll even be like at an angle, almost looking more like scratch marks. They go at a diagonal. I also frequently see them on the backs of the legs and then on the backs of the arms, but also around the armpits, sometimes on the abdomen as well. I always like with my new patients to look at the back. I figure you can tell me about what is on the rest of your body, but you don't look at your back very often and you will see that. So mom knew at that point that Bartonella was part of it. So we thought it was interesting because mom has OCD herself. She actually knew what PANS and PANDAS was. So she understood, because she had done so much research on her own, she understood that this was something that had completely changed inside of her daughter. This wasn't something psychiatry was going to be able to fix. There was a regression in her schoolwork. She couldn't even do basic math at that point. So they, first of all, went to a naturopath who had very specific PANDAS protocols that do help some children, but they were not effective at all for Emma, unfortunately. So she was at that point not able to go to school, and she had a tutor at home whose son had PANS. And so they referred her to a PANS PANDA specialist, and she had 2 IVIG treatments. So IVIG is the intravenous immunoglobulin, which helps boost the immune system. It helped a little bit, but mom told me that she knew in her gut that she had Bartonella and it needed to be treated. So she had gone at that point from like sleeping in her bed to sleeping on mom and dad's floor. So when she had the IVIG, she was back in her room and able to sleep there, but then she regressed again and ended up back on mom and dad's floor. So I think it's a really important point, like intravenous immunoglobulin, IVIG. I hear some people say, oh my gosh, you have to have it to get better. You have to have it to get better. And for some patients, it is important and helpful, but you still have to address what triggered this sudden onset of symptoms. You have to still address the cause. And that was the issue with Emma. She then went to another provider and was referred to us. So mom and dad, I have to give all credit to them, were just extremely throughout this willing to try anything, very confident that Emma could get better, but not afraid to try different things and not afraid to stick with it. So one of the things that was most helpful for Emma was antibiotic treatment. About 3 months into taking rifampin, which is an antibiotic that has excellent effects against Bartonella, it is really good at penetrating the blood-brain barrier. So it wasn't until about 3 months in with the rifampin, but the anxiety went down and she started to feel safer. And she hugged her parents for the first time in 3 years because she hadn't done that in 3 years. All of that affection had kind of drifted away because of because of all the fear. And really what Emma was doing is she was just trying to make herself safe. She was afraid. If you ask her about it, she says she doesn't remember a lot of it because she was in a very different place mentally. You've got all of that neurological inflammation. The things that she does remember, she knows that she has less brain fog right now and she has less rage. And I asked Emma if there was anything that people should know about her, and she did say that she is hardworking, which she is 100% very, very hardworking. And I asked if there's anything people should know about PANS and PANDAS and Bartonella, and she made me promise to say this, her mom did, but that they should come to me to get better, which is very, very sweet. But there are other people who can help you too. And a lot of it's being an advocate, and a lot of it is the mindset. So a couple of things that her mom, Dana, said that I want to share, because I think these can be really helpful and informative for parents, but also for patients. That first of all, if you don't get to the root cause, which is the infection in this case, you won't get better, or you will, and that when it will come back. So you have to get the root cause. I unfortunately see people who, in medicine, in healthcare, in politics, in so many things, there are all of these false dichotomies that it's either or. We've talked about before patients who just want a pill to fix everything, and we did do a lot of different things that we'll address, but then other people who would rather die than take an antibiotic, and they might get their wish, honestly, some of them, by being that stubborn, because in this case, the enemy is not a certain form of treatment. The enemy is the infection, and you have to do what's effective. And in the case of neuropsychiatric Bartonella, it's very, very difficult to penetrate the blood-brain barrier without using medications and treatments that target that. So we did use rifampin. We also utilized methylene blue, which was important. We did nutrient testing, and we looked at what nutrients she was low on. We did some genetic testing and found that one of the things Emma has to have is a very specific form of folate called folinic acid. Another thing that she did, which I think was very helpful in helping the brain shift, was they were willing to do neurofeedback, which we talked about. Now, you remember at the beginning, Emma did not like to leave the house at all. Dad had to carry her out. And it's a good thing she's past that now because she's grown quite a bit. She's a tall girl. He would have a much harder time at this point. But she did neurofeedback. And one of the beautiful things about neurofeedback that we've mentioned before is it can be catered to someone's individual interests. So because the neurofeedback program runs through our computer, and then what's changing because of that is the display on the screen, we do have some sort of set, they're called game environments, but visual images, different things that can play, but we can also run it through YouTube so that you can watch whatever you want. And so we were able to actually play things about the anime that Emma really liked while she was doing neurofeedback. So that was a really nice bridge, because even though leaving the house wasn't fun, it was to do something that made her feel safe. Now, I can see some well-meaning parents, educators, providers saying, hey, you can't do that. You've got to think about and do other things. This isn't healthy. This isn't healthy. But thankfully for Emma, her parents recognized that this was the OCD and that it was what made her feel safe. And so they were willing to help make those accommodations. And she started going because it was fun, but then she and my son Daniel, who does our neurofeedback, became buds, and she told people that Daniel was her best friend and she liked to come and do that. And so that was a really important step, because first of all, neurofeedback does help the nervous system re-regulate itself and be more responsive to treatment. But also for Emma, it was a great bridge because it was a way that she could leave the house but still be doing something that was in her comfort zone. One of the other things that Emma's mom, Dana, said is that you have to be a warrior mom. You have to be willing to defend your kids and go where you need to go to get the right answers. I have had some patients and individuals I've met in the past that they're going to get their kid better, but darn it, they're going to do it a certain way. They're going to go make that pediatrician or infectious disease doctor or psychiatrist understand. And they're going to do it with things that their insurance pays for because that's how it should be. And you know what? It should be that way, but it's not. And if you really, really want to get well, you have to be open-minded. You have to look at all of the different things available to you. You have to recognize that a lot of it's not going to be covered by insurance. And that's not because you have greedy, selfish practitioners who don't want your insurance. It's because insurance is not set up to take care of this type of issue. It's because for whatever reason, there are political forces that treat a lot of these chronic infections like they're not real and will demonize or punish people who think outside the box and are willing to look at research. Remember that research is about 20 years ahead of quote unquote best practice. So just because something's not the standard of care doesn't mean it's not going to work. And obviously the standard of care for Emma wasn't going to work. Giving an SSRI might help marginally with some symptoms, but this wasn't a serotonin issue. She didn't feel afraid and feel like she had to isolate herself in this anime world because her body didn't have enough serotonin. It's because she had an infection that was causing neurological inflammation. Another lesson I think we can take from Emma's case study is that the real improvements began about 3 months into the rifampin treatment, and we were doing other things. Remember, we were doing neurofeedback, we were doing methylene blue, but 3 months is a long time. That takes a lot of faith as a family to stick with it and to keep taking it even when things haven't changed yet. But they were willing to stick with it because at a certain point, too, what's the alternative? If you know what's causing this, you know what treats it, and you know that it's protected, you have to stick with it. And sometimes there are people who get results pretty quickly, and I'm always super grateful when they do. But sometimes it's like you're going, you feel like you're pushing against a wall. Why am I doing this? And then one day something just gives, and you have that breakthrough. So hats off to them for their persistence. We also found really elevated levels of mycoplasma. So we used minocycline too, because it's excellent against mycoplasma and also good at penetrating the blood-brain barrier. One of the things that Dana said that I thought was really helpful too, she said, because she has OCD, Dana, I knew exactly how she felt. She could tell her and know it that it's the infection that's causing the fear, because she knew her child before, and before being sick, Emma wasn't afraid of anything. She was fearless. She was a healthy, active girl who was out doing kid stuff and enjoying life. And so obviously not everyone who has someone they love happen to understands their symptoms, but I really, really encourage you, even if you don't understand or if it doesn't make sense, to believe the people in your life. Who on earth would want to make this up? Who would want to slip from their healthy, active world to one that's like totally isolating? Obviously, those feelings are very, very real. And OCD is really a lot of times the body trying to create safety, because a hallmark of anxiety is lack of control. And when you suddenly feel completely out of control, your body is desperately, desperately, desperately trying to find ways to create control and structure so you don't feel safe. Something else that Emma and her family went through that is unfortunate is it's very isolating. Dana said, you lose friends, you gain friends, you become very isolated. People don't know the gravity of it. And they don't. They don't. I think there are some people who are well-meaning but just don't know how to relate. There are some people who are very judgmental and can't deal with it, makes them uncomfortable. So rather than try to understand or stick around, they either judge or they take off. Everybody has all the answers for you. And most of the time people are trying to help, but just know in your life, just because you know someone with anxiety or OCD or even PANS and you know what helped them doesn't mean it's going to help everyone. That's part of what makes this so difficult. It's so nuanced and everybody's so different genetically, as far as family support, the actual infection that they have. So there is a link, and one of the things that, like I said, was a clue, a diagnostic clue for Emma's parents, is the fact that mom had OCD and she had multiple family members who have OCD and have tics. So mom said it was okay if I shared a little of her story. She's had OCD since she was young. But then last year in August, she had a sudden, really severe flare in her OCD and anxiety. And it was really, really horrible. And, we tried manipulating the psychiatric medications with maybe a little bit of benefit. We tried saying, well, you're around the same cat. We had tested for Bartonella. Bartonella came back negative, but we said, well, let's give it a go. Let's just try and see if there's any benefit. Nothing. We finally decided, and I don't remember exactly what was going on symptomatically, but we did a urine test and we found strep in Dana's urine. And as soon as we started penicillin, the anxiety started to drop. I mean, it was very, very quick. Now, what caused the flare? This is another important kind of diagnostic clue, is at the beginning of August, when all of these symptoms started, she had had a steroid injection in her shoulder. Now, I know a lot of well-meaning pain management specialists, orthopedic guys who really, really push these steroids and will tell patients, oh, it's local, it's such a small amount, it couldn't affect you systemically, yada, yada, yada. But a steroid suppresses your immune system. If your immune system has been fighting with and trying to deal with a strep infection or Bartonella or Lyme disease or anything else, then all of a sudden those symptoms can flare. I've seen a lot of patients who with immunosuppression get worse. So, if you have a steroid injection for pain or on a course of steroids for pneumonia and you get some really wacky health problems, my first thought is there an underlying infection that has flared and the steroids impaired the body's ability to take care of it? Unfortunately, one of the big ways we deal with chronic disease in this country is to suppress the immune system. There's commercials now. I think it's hilarious. This one particular pharmaceutical in general. I'm watching basketball last night and you see a commercial for the drug and it's advertising treating rheumatoid arthritis and psoriatic arthritis. And then you see a few timeouts later, another advertisement for the same drug advertising how it's going to treat Crohn's and ulcerative colitis. It's crazy. It's not this miracle drug. It's an immunosuppressant. So they found a new way to suppress the immune system and they have a new patent on it so they can make new money and claim, oh, this works different than this other one. But it still suppresses the immune system. And at the end, if you listen to all the things that can happen to you, you could get a life-threatening infection. You could get cancer. You could die. I mean, there's some pretty severe possible adverse effects, but you have to be very, very cautious. Immunosuppression sometimes is important. If you've got a transplant, you've got to do some immunosuppressant so your body doesn't reject the transplant. Sometimes things are going so crazy with inflammation, short courses of steroids can be beneficial. But in general, you want to aid your immune system, not shut it down. So I want to tell you a little bit more about how Emma's doing currently. She is lights out fantastic. We did some recent testing. We're still dealing with Bartonella and some Babesia, but the mycoplasma appears to be taken care of. She's doing fantastic in school. She's become a great artist, and she said that I could post in the show notes. I have a picture that she made me. It's an anime style Christmas card that's just fantastic. She actually is starting this month a job at Dairy Queen, and I am so proud of her and so excited. I'm just thrilled. And she told her mom that she was scared of it, but there was no going back now because I already knew that she was going to be working at Dairy Queen. But I want to tell you another really smart thing that Emma's doing and that her parents are helping with. So the anime stuff still makes her feel safe, and she still wears anime clothes every day, but she was able to problem solve. She knows she has to wear a uniform at Dairy Queen, so she's going to wear her anime shirt under her Dairy Queen uniform. And again, hats off to mom and dad for helping with some really smart problem solving, because I know some people who would be devastated and say, oh, this is terrible. She still has to wear this all the time. But Emma's got a really smart set of parents who said, no, if that's what makes you feel safe, let's just problem solve. You can still wear it. You wear your Dairy Queen shirt over top of it. And that's a fantastic, fantastic solution. Progress is slow, but at the same time, you have these huge gains. And as long as you're going the right direction, it's still good. Don't sit around wallowing in what you still don't have. If you can focus on the gains, which in this case have been tremendous, you're going to keep making progress. I think a lesson that anyone can take from this is, first of all, advocacy. Second of all, trusting your gut. Many of us who have children who have become sick have been told a lot of hopefully well-meaning but very unhelpful things about what to do. Understand that there is not a pill for every mental health symptom. These SSRIs that for a subsection of people have been beneficial, it's become a scapegoat for the medical system, because now it's all on the patient or the family that they just need to find the right medicine. Well, they just need to try a different one. Well, try Prozac, try Zoloft, try, Luvox, try this, try that. But if it's not a serotonin problem, that's not going to work, and it can make things worse. And I would just like to say, again, hats off to Emma, one of my favorite patients and people of all time. She decided she was already excited about her job because she's going to be rich, but now she says she's going to be rich and famous because she's been featured on this podcast, and she is an inspiration to me. And I'm thankful to her and her parents for their courage in letting us share this story, because I think it's really, really important that more people understand this really unique way that disease sometimes manifests itself, so that you can be compassionate, so that you can have your eyes open and help more people. Remember, they estimate that at least 1 in every 200 kids has this. That's a lot of kids. So that's probably people and you may be someone who recognizes what's going on and can help point someone in the same direction. So remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.